Hello, everybody. This is Dr. Kondrot, and I want to welcome you to Ask Dr. Kondrot a Question. This is primarily a meeting for prospective patients who want to find out more about my work. And I welcome all of you. And let me just go through some guidelines here. I would like you to turn on your camera, your video camera. You can go to the bottom of the screen and hit start video so I can see you. That'll be great. And also, if you could mute your microphone, unless you're going to be asking me a question, this way I'll eliminate a lot of the background noise. Let's see. Most of you that are on are already muted. And the way to ask a question is you can ask your question in the chat button. Let me see here. You don't have any questions so far. Show chat previews, chat. Yeah, I can see the chat now. Or the other way, you can ask a question just by raising your hand, and I'll call on you. And there's also a little button you can press at the bottom to raise your hand on your computer. Let me see if I can do that on mine. Let's see here. Nope, I don't see it on mine. But anyway, let's begin. I want to welcome everybody, and it's great to have you all here. So if you have a question, okay, Ron B. Ron, how are you? You have to unmute yourself. There's a little button that you hit. Unmute.
How's that?
Okay,
hear me
great.
now?
I hear you. Oh, how are you, Ron?
All right. I finally, after over 6 months of working on this, got rid of this pesky infection in my right eye. My left eye's been cured for a couple months, but we've been having a go-around with this right eye, and I've been on antibiotics for it and Decadron for it and betadine eye drops for antiseptics for it and antivirus paste and antivirus pills. We've just gone through the whole gamut of everything, and it's not that I've just done it at one time. We went through this 3 or 4 rounds of it and still didn't get anywhere. So we've been extending my appointments instead of week to week and 2 weeks to 2 weeks to months to months. And finally, this last month, we were down to 1 betadine drop and 1 Decadron drop in my right eye a day. And I figured without the other medications following me up and taking up my schedule all day long, I'd do my own thing. So I started 24/7 every 15 to 30 minutes doing ozone in my eye. And after 2 or 3 weeks, I felt like my eye was really starting to heal up just using the ozone. And by gosh, I go in Friday and it's all healed up and looking good.
Well, yeah, I love the ozone. The ozone can work miracles.
Well, it certainly did
Ozone
for
is
me
a
this time.
highly reactive form of oxygen, which is also antiviral and antibacterial. And it also helps with regeneration. So I'm glad that the ozone has helped turn things around for you.
Yeah, I didn't tell him I was using this. I suggested ozone a month ago, and he seemed to not know much about it or didn't want to respond to it. So I dropped the issue with him. I saw he wasn't on that line of thought at all. And he told me in the beginning when he first saw me, when I was referred over to him from my regular ophthalmologist, and this fella's specialist in can't think of words today. Anyway, he looked in my eye and immediately said it was infected and we got to get you off all your drugs. Either you're allergic to it or they're causing irritation to your eye, and stop taking the 3 or 4 pressure drops you were taking each day. Evidently, they were scarring up my eyes terribly. And he said, we got to get this infection cured, and you're definitely going to need some surgery to get rid of all this scarring.
Well, we
And
have to find out what
once
caused the
again, through the
infection.
treatment, he talked about getting rid of the scarring with surgery. And yesterday, since we got all the infection cured, I said, what now? And he tells me, well, I don't think you're a candidate for surgery after prepping me for surgery for so long. So I don't know his reasoning behind that, but that's kind of where I sit right now. The only comment he made about that is he said, well, he didn't want to cause me to go totally blind. I'm getting a little light vision in my right eye where we got the infection just cleared up, but he says I have a great big scar right in my straight line of vision, so that's why I'm not seeing much in that eye at all. My left eye's been improving right along. We did kind of a practice what do you call it when you refraction yesterday. The nurse in there did it for me, and she was having me down to 20/50 already for sure. And I was reading a lot of the letters on the 20/40 line and even a few letters on the 20/30 line. So I think I'm making excellent results on my left eye. And I was wondering with glasses whether I'd have good enough vision to be able to drive again. The only problem with that is I have this fogginess that I'm looking through all the time with this scarring, and that's not sitting too
Well,
well with me.
let me answer your question here, okay?
All right.
I'm going to put you on mute, and I'll talk a little bit about what's going on with you. So first of all, I think the ozone eye drops can help reduce the scar tissue. They're anti-inflammatory and they help with regeneration. But scar tissue is really tough to treat and it's slow to resolve. But I think we can shrink the scar. Other modalities, other treatments that we can use are microcurrent. And I think Susan had a question about microcurrent. What microcurrent device do I use? And what I'm going to do is I'm going to share my screen here with you folks. Just a minute. I'm going to show you where to go on my web page to get a lot of information. Okay. 1 minute here. Let me share the screen. All right. Okay, those of you who have a computer, you should see my website. You can go to healingtheeye.com. I have a little introductory video here. Right here, there's some peer-reviewed studies published by myself on some of the modalities that I use. As many of you know, I'm the surgical director now of site.org. In fact, tomorrow I'm heading to Madagascar, Africa to do some charity work there. But this is the area right here. See this new to this site. If you click that, I go over 3 steps to restore your vision. First step is to download a copy of my best-selling book. Essentially, all my methods are outlined in this book, and if your vision is poor and you can't read, you can always, I have a webinar on the 10 essentials. View a webinar dealing with your particular eye problem. You can also schedule a complimentary eye record review, and many of you have done that already. Here, right here, you click here, you can download my best-selling book. And here you can, if you have poor vision and you can't read or have difficulty reading, you can watch the summary of the book right here. Next, to find out more about your condition, Here's one on cataracts, glaucoma, macular degeneration, dry eyes, floaters, macular pucker, macular wrinkle. In fact, it's interesting. I just consulted with an alternative doctor who had a macular pucker and retinal membrane. And I started him on microcurrent, and he had phenomenal improvement of his macular pucker, which he was kind of surprised. In fact, he's beginning to use microcurrent in his practice now. I also have a podcast. You can go there, view some of my podcasts. And Susan, you had a question about microcurrent. This is a whole video here on microcurrent medicine of the future, all about the microcurrent device I use. I've been using microcurrent for 15 years. We use a device called frequency specific. It's a very, very low electrical current, which matches the resonance of the tissue we're trying to treat. And essentially, there have been many studies done to show that microcurrent can reduce scar tissue, improve, reduce inflammation, improve oxygenation, and help healing. And that's a big part of my practice. Also, homeopathy. There's a video here on homeopathy. Here's all about ozone. And Ron has been using ozone eye drops. They're easy to make. Unfortunately, you can't buy them. You have to make your own, which is kind of simple, and this video goes over that. You can also do rectal insufflation and auricular ozone, light therapy, and chelation. So all this, you can find that on my website right here, and click this box right here. So that's the best source to get a lot of information that can help you. But Susan, I'm going to unmute you. I hope that answers your question, or do you have something in specific? You can unmute yourself, Susan.
Unmute me.
Hang on,
Yep,
I have to do it for her. She
Hang
can't
on a
see.
minute. I can't see. Hang on.
All right,
Okay,
I see
you're
you,
on.
and I guess that's your husband or boyfriend, or
Yeah, that's Bob.
I'm her seeing
Hi,
eye
Bob.
dog. Hello.
Okay, I have been using the microcurrent. I guess I needed to know exactly, would it help? Does it help with retinal degeneration?
Yes, it does. What are you using the microcurrent for?
My eyes?
And how long have you used it?
About a month and a half now.
Have you noticed, are you doing anything else besides the microcurrent?
I'm also taking your vitamins. That was my second question. I think it's what are those vitamins called? No way, we're going to get you the bottle. I've been taking those also for a month and a half. With the vitamins, I'm not really seeing a lot of results, and I've been doing that also for a month and a half.
And that's the Ocufola that you're taking.
Yes, yes.
Well, first, I'm happy you're here, but you're in the wrong group. This is a group that for prospective patients who are not doing treatment. All my active patients that I'm treating, I meet with them the first and third Saturday.
Oh, okay.
So this is, you're kind of more advanced. You're doing the treatments. This is mainly for people who are just getting started.
Oh, okay.
So this is the drug she's taking.
Yeah.
That's yours. And the microcurrent she's using right now. Those are the protocols that she has on them. I don't know if you can read them, but she does the top
I can't.
one.
What does number 1 say?
I need to turn on some light. Hang on a minute. Macro degeneration. And the second one is circulation. That's about the only one she has on here for the eyes.
And what's the third one?
Third one is inflammation general, then immune support, digestive, prostate, thyroid, 2 thyroids, pain, skin and wound healing, and that's it.
Now, who you're not under my care. You're under someone else, aren't you?
We're actually doing both. We had contacted your office, and they gave us 3 different things we could do. The second one was buying the items from you guys, And that's the one we had to opt for at the time because we couldn't afford it. And then later on, that gentleman you had on your show, Fletcher,
Mhm.
he contacted us and said that he could get the microcurrent for us. So we just got that from him.
Yeah,
He
well,
put
you should
the-
be asking him all the questions about the microcurrent since he is your doctor. It's not fair for me to supersede his advice. If you're under his care, you should consult with him.
Yeah, well, we're actually not under his care. He just gave us the device and that was pretty much it. So,
Well,
what are
he
you gonna
shouldn't have
do?
done that.
I'm,
You know, if you're
I
if you're
know.
part of my program, I continue to take care of you. But these are different protocols on his machine that I would give.
All right, well, I guess our question probably would be is how do we probably get into your care? Because he pretty much,
Dismissed it.
yeah,
Yeah, because it's more than the microcurrent. I think that this is for everybody on this meeting. Microcurrent can be extremely valuable, but we really have to look at the underlying cause, whether it's nutrition, heavy metals. Also, I'm a big advocate of homeopathy, which treats the underlying problem. So I would probably give Chris a call in our office and she can talk to you about how you could get part of the program. But I would probably
Okay.
have to reprogram your machine and, consult with you personally, take your case, and essentially would have to start from square one. So there wouldn't be, the full cost for the program. You would get a discount because you have the microcurrent machine, but we would have to reprogram the machine.
All right. We'll have to talk to
Now,
Chris
it's
then.
also nice because we have a method now that we can reprogram the machine online. By that, I mean, I'll hook up to your computer. We do a remote session and I can change the frequencies right at your home.
Okay.
So you don't have to send it to me. And
Well,
that's
that's
nice
good.
Oh, that's
because
good.
if the frequencies don't work, see, we're trying to match the resident frequency. Studies have been shown that if we hit the right frequency, it'll resonate with your particular area of your eye and help regeneration and changes. And that's
Yeah.
based on, what's going on. So I think it's kind of remarkable.
All
Heavy
right.
metal testing is important too. And homeopathy. I like homeopathic treatment.
Yeah, we're actually doing that ourselves too. But we definitely like that.
Yeah.
We just need some more guidance.
Mhm. Yeah, so I would give Chris a call
Okay.
and she can tell you how you get started, working with me directly.
Okay.
All right.
All right,
Sound
so
good?
thank you. Yep,
Oh, thank
thank
Very
you.
you.
My
good. Thank
pleasure.
you for all your help.
Thanks. See, James has his hand up. If you could unmute yourself.
Now get off that thing there. How do I? Yeah, I can't. Shit.
James, are you there?
Yes, I'm here.
All
Am I-
right. Yeah. Okay. Hi.
All right. I'm on the eye drops, the Ocumed, and I've got the total ocular function. I just finished this one. And I've ordered, this is David, by the way, not James.
Okay. Well, your name's showing up as James. I guess you're.
Right, that's an error, but I'm David. We had a conference a few days ago. I'm from California. I've ordered the light therapy and the homeopathy and the vitamin formula. But I've also ordered the chelation test, or the detox test. I guess ordered that, but I'm on Touchstone Pure Body Extra. These are detoxes. The question is, when I get the detox thing that I pee in, you need to know that I'm taking this stuff. It may have an effect on what shows up in the urine since I'm taking this. Or should I?
And who
take it?
prescribed those for you?
I got this off the internet. There are a lot of people selling it, and a friend of mine has had real good results with it. It's detox that gets into the cells and detoxes from the cells out. It's called Touch.
Now, are you part of my program? Are you doing
Yes,
this?
I'm part of your program. I'm just getting started. Only
And you're
thing
gonna
I've ordered is these two things I'm using. The other stuff's not here yet.
So you're going to be using the microcurrent then too?
The microcurrent will come later when I get the money. That's $3,000.
Okay, well, you're really not part of the program because the program is all those modalities.
Right, I'm not in the whole thing yet, right.
Yeah. And you're probably in the wrong group because this group is for people who just want information about the program. You're in it.
Okay, so
First,
I
the
need to
first
get
and
a,
third Saturdays are when I do the program for people that are active involved, because a lot of the questions you're asking may be over the head of people who are just
right.
getting started.
Chris is gonna email me the times to get in, right? Or should I call
Yeah.
her?
Yeah, and also for anybody, Chris, when you're in the program, Chris has weekly meetings to answer basic questions. And really, we have to give everything in the program at least a month or so to work. And you really have to be doing everything to see if we get a good result. Now, sometimes, a simple treatment like detoxing or starting a homeopathic remedy will help it. I have found that you need to do, all aspects of the program to get the best results.
All right. Okay, thank you.
All right. Okay, let's see here. I'm going to stop the screen sharing here.
Thank you.
All right.
Video.
Okay.
Start video.
Okay. Any other questions? Especially some of you people who may be on this call for the first time. I'm sure you have a lot of questions, and I'm here to help you the best I can.
Yes, I have a question.
And who's talking? Oh, Barbara.
This is
Hi,
Barbara.
Barbara.
I'm for the homeopathic remedy. If it got a child protection thing on it or something, I have the Dickens getting the lid off.
Yes.
I'm gonna
Okay.
break it. Huh?
Do you have the homeopathic remedy there with you?
I've got the directions. Yeah, I'll get it right quick.
Because the remedy I recommend is a bottle, a dropper bottle.
It's a dropper bottle, but I can't get the lid off.
Yeah, me too.
And I'm afraid that I'm going to break it.
Well, you know what? I think when you first get it, there is a shrink wrap on it. You have to cut the shrink wrap. Otherwise, you're not going to get it off. I'll have to wait till Barbara comes back. You may be trying to get it off with the shrink wrap on.
Sorry. A shrink wrap.
Yeah, there's a shrink wrap on the top, and it'll be impossible to get it off until you break that shrink wrap.
Well, a shrink wrap, this is plastic. A plastic wrap is off.
Yeah, it's called a shrink wrap.
Okay, that's all off. But
Okay,
there's something that it won't screw.
Yeah.
And what happens is I do this business, but before I can get the top off, I've lost the potency of the shaking.
Yeah, you got it.
No, you don't lose the potency. Once you shake it, the potency is increased.
Okay, yes, but if there's a 5-minute delay in the pouring,
it's not like fizzing a soft drink where you shake it and the bubbles come up.
yeah.
If you hit the homeopathic remedy 5 times, you're increasing the potency. It's not like if you wait 5 minutes, the potency is going to go back to what it was before you shook it.
So why is it so hard to get the lid off? And is there a danger of
believe it or
breaking?
not, that's the first time I heard of that complaint. You may have to get some help to
Am I
open it
supposed to
up.
push it down real hard?
No.
No.
You just turn it.
Oh, no. Well, let me see. It turns, it's turning. I don't know if you can
But
see
it
that.
doesn't come off.
It doesn't come off.
Right, right.
That's a problem. We're gonna have to notify the company.
Well, I was gonna call the company and just ask what's going on. If you
Now,
you
maybe
can-
they've changed the bottle
the bottle,
regulations,
because I
but
can't get the lid off without.
I've
I'm just afraid it's
I've
gonna
looked at
break it.
hundreds of those bottles, and you just simply turn it, and it comes right off. It may be defective, or maybe they've changed the bottle.
If they change the bottle for this, it's the kind of thing like, you know, some bottles are child protection.
Right, I know what you
That's what it
mean.
feels like to me.
You're gonna have to call the company,
I will.
and also call Chris. Maybe Chris can do some research on it too.
Okay, okay.
But I'm
Well,
sorry you're having trouble with that.
well, I mean, I've done it. I've only had it for a couple of days, so I've done it twice. And I'm using the syntax, and I want to move when I'm doing that. Is that bad? I mean, not move. I mean, not move my eyes, but move my body.
Yeah, I think it's okay to move your body.
Huh? Is it okay? Like if I want to do this,
Yeah,
as long as I'm looking in the thing.
yeah.
Is that
It's
crazy?
not going to cause any problem if you move your body. It's better off if you're quiet and meditate and try to reduce your stress.
Oh, really?
Yeah,
Oh,
deep breathing.
oh, so don't be okay. Not just
You
doing the
want to
reverse.
quiet your autonomic nervous system.
Okay, so I should do some
All
meditation.
right.
Okay.
All right. Now Jean has her hand up. Jean,
Thank you.
Yes.
if you could unmute yourself.
Oh, how do I do that?
Oh, you're unmuted.
Oh dear. Now I've lost you altogether. Oh no. All I
This is
wanted to
Jean.
say, yes, it
This
is
is
Jean.
Jean
And
talking.
all I wanted to tell you was that I'm having exactly the same problem with my bottle. I cannot, I have to. Hello?
Yeah,
Yeah.
I'm hearing you.
Yeah. Oh dear. I don't know how to get you back again, the visual, but that's the same problem as that lady, as I'm having that same problem. And it isn't any plastic that's on it. You have to, I just have to fiddle with it until I get it off. And so, and I'm like her, like I've done my succussion, and then I can't get the lid off. So then I did talk to Chris about it, and she said, well, if you can get the lid off, then you can succuss it then, but then, then you lose some of the drops, because when you're succussing, it kind of flies out.
No, you don't lose the potency if you don't succuss it. Once you succuss it, you increase the potency. You don't have to do it again if it takes you 5 minutes to get the lid off. That's wrong.
Okay, all right, that's fine then. I understand that, so I won't worry about that now. But it is a funny bottle, because I think it's the same. It's like it's childproof, but if you
Yeah,
try
well,
to
maybe the manufacturer changed the bottle top, but that's new to me. It must be
Yeah.
something new.
Okay, so I will contact Hahnemann myself and see what they have to say about it.
Mhm.
If there's a trick, because it's like there must be a trick to opening this. I've opened like many bottles of homeopathics. I've been using homeopathy for 20 years, so it's not like I'm new to it or something. So okay, that's all I had to say.
Okay,
so,
well, good luck.
all right,
Thanks
then.
for bringing that to my attention.
Okay.
Okay, Deanna has a question here in the chat about dental root canals on the molar and premolar. and the dentist is recommending to put some implants in. Well, number one is the root canals can interfere with the meridians. It's kind of tricky. And these meridians do cause sometimes problems with the eye. And it's always a good idea to go to a integrative or biological dentist, as they call them, biological dentists. These are dentists that are more aware of the problems that improper treatment of root canals and implants can cause in the body. And they are associated with eye problems. In fact, there's a joke that some people say, if you have an eye problem, you should first see your dentist before you see the eye doctor. I don't know if that's true. It's probably dental propaganda. But anyway, I think you need to see a good biological dentist. Now, whether or not the zirconia implants will cause a problem, you need to be muscle tested and your body needs to be tested. So it's a complex issue. And I would research and get an opinion from a biological dentist. And there's a group of them. Deanna, where do you live? I want to unmute you.
I live in Germany, in Munich.
Okay, well, there's a lot of really good naturopathic and practitioners in Germany. You should be able to find somebody there.
Yes, I am basically with biological dentist.
Yeah,
And-
well, then he's the one to give you the advice. He should muscle test your body and do some, studies to see.
Okay, because the recommendation is like root canals are very bad, it's not good. But on the other side, I don't know, because of the zirconia implants, they are foreign body in the system. So I'm very sensitive on everything that is foreign for my body. So it can cause the same problem, basically not the same problem because of infection, but zirconia implants, it's a foreign body. Of something foreign in my body, so it can be again on the meridians blocking. Like
Exactly. Well, then you may be better off then just to go without the implants. Get rid of the root canals and go without the implants.
yeah. Okay, thank you very much. That was my dilemma.
Okay, thank you and good luck. It's a tough problem,
Yeah.
and there's no question that root canals can be extremely, extremely toxic to the body and cause all kind of problems.
Yeah.
And that's, there's a lot of really good, it sounds like you're seeing a good biological dentist, and that's what you really need.
Yeah. Pretty much expensive, but what needs to be done needs to be done.
Yeah. And keep us posted, okay?
Yes, of course. Thank you.
Any other questions?
Well, I been listening. This is Laura McKinney. I haven't been able to raise my hand on my device.
Can
Oh
you
my
put on
God.
your camera?
Well, now I did, but I don't
Yeah.
know now I don't see. I have trouble with my digital equipment. I've been having
Okay.
trouble for a long time, and now I lost everything. How do I go back to it?
Well, anyway, I can hear you and you can ask your question.
Oh, thank you, Dr. Kondrot. I've been concerned with the same thing, and I didn't have that in my questionnaire, my questions, but that's the only surgery or work I've had in my body. I have never had any surgery in any part of my body but my mouth, and I've had root canals, and now I see why. And the doctor is recommending now implants. And I'm glad you're explaining all that. So I need you to refer me to a good one of those good dentists that would take care of my problem. But
And where do you live?
I live in Hot Springs Village, Arkansas, USA. United States.
See, I'm searching here, biological dentistry. There's a group of doctors. Yeah, here it is. I'll put this in the chat. Are you able to see the chat?
No, I lost the screen. I mean, and I don't know how to go back to it. Do I press Google again?
Okay, let me give it to you. If you search biological dentistry, just Google biological dentistry, the website comes up. I as in ice, A
Okay,
as
okay.
in apple.
Excuse me. I need to get something, because you see, I'm having my main problem. If you remember, or if you remember about it, you have so many patients. But my main problem is a cataract on my left eye,
Mhm.
and so I mean, this is why I was looking for a homeopathic ophthalmologist, because I'm very allergic to drugs that they call medicines. You know what I'm saying? I
Yeah.
react, but I mean ugly, real ugly. And so I'm
Mhm.
afraid to any. And then I went to the excuse me, I'm just trying to get where to take notes. Okay, should
Let me
have
know
had
when
that
you're
ready.
ready.
I'm ready. I'm getting ready. I'm getting ready.
And
Thank
I'm
you.
also emailing this to Chris in
Oh,
case you
yeah, that would be great if you could. Is there one that you could that
well,
you
you
know
go to
that you
their
dealt with?
website. You go to their website and put in your zip code and you'll find out somebody near you.
Oh, that sounds great.
Okay,
That
here's
sounds
the
great.
web address. I as in ice,
Okay,
A
okay.
as in apple,
Let me
B
let me start all over again.
and
I like
repeat.
I like in ice.
Yeah. A as in apple,
Yes, A as in apple,
B as in boy,
B as in boy,
D as in David,
D as in David,
M as in Mary.
M as in Mary.
Yeah, and then .org. That's the website.
That O R G, and that's
That's it.
for what kind of a dentist?
It's the International Academy of Biological Dentistry and Medicine.
Okay. Okay, that's an acronym. Okay.
Yeah,
And
and if
then
you go to their website, you can type.
how do I get to their website? Will you tell me
Well,
again?
you type that in your search engine on your
Type
computer.
on search.
Okay, give me your zip code.
71909.
Okay, I'm searching right now for you.
Oh, thank you. I appreciate that. See, yesterday I turned 84 years old, and I'm very happy to be still alive. But I have advanced neuropathy, and you know that works in the brain.
Yeah.
And the reason why is because I got scared to death when I went to check my eyes, and then the doctor sent me to the ophthalmologist, and the ophthalmologist told me that I need surgery, and that it won't give me glasses until I get the surgery. And that was really a hard blow to me, you know, because I am scared to. And I asked him, what would happen if I'm allergic to the gel they use to numb the eye and the drops? Because I've had a reaction to drops, you know. And then he said in very, um, you know, the vocabulary of you doctors, that I would lose my eye. I would say that's.
Well, unfortunately, I haven't found anybody in your area.
Oh,
There doesn't seem to be anybody in that area. But anyway, go to that website and play around with it. You may want to look at a state next to you.
Thank you very much, Dr. Kondrot.
Okay.
And I want to go with my main question, my main thing because see, I haven't started anything yet. I'm just getting information, and I want to start as soon as I can. But my main question, because I want to go, and the choice number 1, I was given 3 choices, and I want to go number 1, and then I have the price for the 3 months, but I want to do the 12 months or do the complete thing, and especially because of my age, I'm not going to react I don't expect to get well as easy and fast as I did when I was in my 20s, when I started with homeopathic medication, say. So anyhow, my main question was, if you could answer now or send me some information, how much would it be the whole 12 years? I mean, I know that you couldn't give me an exact amount, but approximately, amount, because I want to have that money
Okay,
ready.
we used to have a 1-year program, but I have found that most patients don't need the 1-year program regardless of their age. Usually 3 months is enough to take care of, at least get them on the right track. See, my goal is to empower you, not to become dependent on a doctor. I want you to learn techniques and treatments that you can continue to do on your own. So number 1, most patients don't need a doctor to hold their hand for, you said 12 years. I think you made a
No,
mistake.
12 months. 12 months.
Okay.
I said 12 years. I'm sorry.
You said 12 years. I know you made a mistake, but I thought, well,
12 months.
you're like me.
I'm sorry.
I plan to live to 95 plus. So 12 years, you're 80, you're going to be right around my age. So anyway, most people in 3 months are doing well enough that, they know what to do. They can still join these groups and ask questions. Once you join the program, you're kind of my patient for life. So you can join these meetings
that's
and
what
still ask me questions and bother me. But
No, that's I don't want to bother you, but I do want to have guidelines, and
well,
then
that's my job. My job is to let patients bother me.
that's funny. Well, I've been trying to get to talk to you since July, and I mean, it
Well,
seems
that's
it's
why
been
we have these
something.
meetings.
Yes,
We have these
but you've
meetings so you
been
get to meet me and talk to me. But let me explain. You wanted to know if you wanted to do a year. Well, after the 3 months, we have a continued care program where you can continue to work with me, one-on-one. I can change your microcurrent machine. And I think what's the cost for the continued care?
I
Miss
beg your
Lee,
pardon?
the cost
Are
for
you?
the continued care?
Yes, that was my question.
1,295. Yeah, the continued care is $1,295. So a little over $1,000. You can extend it for a year.
Well, that sounds reasonable for giving me peace of mind.
Yeah,
You
but
know.
I'm hoping that most people, all I need is 3 months. We used to have a year program, and then I find out that most patients, I don't hear from them after 3 months. They're doing well, they know what to do, and they don't even keep
Uh-huh.
their appointment.
Uh-huh. 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 Well, and I have something I wanted to tell you. You see, I'm so excited. I mean, I Googled you. I kept on Googling and trying to find a homeopathic ophthalmologist, and then and my friends were helping me Googling on their own too, and nobody could find out. And I mean, it took me days and days of Googling every day until finally you came up. I couldn't believe it. I mean, I was so excited. And so I told my friends I had found you. And all of them are waiting for me to see the results that's going to happen, because I have many friends. And this is not an exaggeration, all over the world. But here
Now, what
locally,
is your main problem?
my main problem is that I looked you for. It was my cataract on my left eye, and I have so many friends here locally. My local friends right here in Hot Springs Village and the surrounding areas, they wanna deal with you. And I talked to a friend in Texas, and people that are very allergic to the other medications, and they're battling. And I talked to a friend. She called me last night, and I told her about you, and she wants information right away. So I tell Miss Chris, I give Miss Chris their information so she could get them the information through the internet.
Yeah, the best place to go is my website. I showed you earlier exactly where to go. You can download my book, it's free. You can go to that one page if you're new to my practice, and there's all sorts of information, videos on what to do.
Well, I
Now, I'm
tried
a
to do
firm
that,
believer.
and I
I'm a
couldn't.
firm believer that diet, food is our best medicine. And I
I
think
agree. I agree with you. I agree with you.
most
See,
of us have health issues and problems because of indiscretions in our diet over the years. Did you
yes,
know that macular degeneration did not exist before 1920?
yes, I read all that, and I heard in one of your videos or whatever that you explained that, and
Yeah,
I
it's not
believe
age
every
related,
word.
it's diet. It should be called diet
Mhm.
related macular degeneration.
Uh-huh, uh-huh. Well, and then I have the other serious thing, because see, my neuropathy, I knew I had it, but then when I found out that I either get the operation or I may lose my eye or go blind. Well, either choice is bad. I'd rather go blind than lose my eye. But anyhow, that made my neuropathy go high up because of the anxiety, looking for you and not finding you,
Yeah,
or
well,
how
the
long.
microcurrent, it works very, very effective for neuropathy. Many naturopathic doctors and therapists use microcurrent for neuropathy. That's one thing that works very, very well. It works well on the eye, but with the neuropathy, it can work very quickly sometimes, and you get
I
benefits.
appreciate that. And I go to a medical massage therapist because that helps my neuropathy and helps relax my body. I mean, you're familiar with that. And
Hmm.
I told her yesterday, when I went to the treatment yesterday, about you, and she says, I have to see that he can heal your whole body. Because see, I've used homeopathy before, and you are the second a homeopathic doctor that I've met that is a medical doctor and also a homeopathic doctor.
So
And to me, that
who was the homeopathic doctor that you were treated?
this is in the last century. You see, remember, I'm 84, and he was about 40 years older than me, because when he started treating me in my 20s, he was already retired. But as
Uh-huh.
he was member of my congregation, my friend, him and his wife. He would not deny treatments. He would. I mean, you know, anything that I would have, I had neuropathy, and he treated me, and he treated my whole body, and I
Hmm.
was having trouble with my eyesight too, and I went back to 2020 eyesight.
Hmm.
That's when I was
Yeah,
30 years old.
homeopathy can be amazing. In fact, all of you are going to be pleased to hear this. I'm having a weekly training session. There are 4 eye doctors that I'm training to learn homeopathy for the eye.
That's something else that I was thinking, Kissy. I never met I've met many other homeopathic doctors that are good, but not as good as was Dr. Ruiz. And he obviously, he's already passed away. I mean, he would be about 120 years old or something like that. And then that's why I was desperately looking for another one. And my relatives had told me that there was one in Mexico, another one in Mexico, but you know that's it's harder when it's not in the same country. You see.
Well, there's a lot
So,
of really good homeopathic doctors in the United States. There's a organization called the American Institute of Homeopathy. This is an organization that was founded 5 or 6 years before the American Medical Association, and these are MD homeopaths. You can go to their website, the American Institute of Homeopathy, and I'm a proud member of that group. And these are
American
Institute, American Institute of Homeopathy.
Institute of Homeo.
Homeopathy. That's the oldest medical organization in the United States.
The oldest. Well, one thing I learned is that the royal family in England, that's what they used, only homeopathy, and that they have hospitals for just for homeopathy medication. And but it would be kind of difficult for me to move to England. You know, I rather have it here in the United States. So, and the oldest, what do you
No, you
tell
don't
me?
have to
This
type that in. Just type in the American Institute of Homeopathy. And if you type that in a search engine, you'll come to the website.
remember, I'm battling with see, I even forgot the word neuropathy, and my brain is not functioning as well as it should. So,
Well,
would
see,
you
the
please?
right homeopathic remedy will help your eyes, help the brain, and help your neuropathy, because we treat the whole person with homeopathy.
Yes, I know. That's what Dr. Ruiz used to do.
Yeah,
And
it's different than regular medicine. Regular medicine, you go to a doctor for your neuropathy, you go to the eye doctor, and you go to a doctor for your brain.
yeah,
You have
tell
3
me
different
about it.
doctors, and they all give you different medication, and you get sicker and sicker.
Yes,
The
tell
homeopathic
me about
doctor
it.
tries to, yeah.
Well, I am so happy I found you, Dr. Kondrot, and I thank you for your patience because I'm not. But once I get well, then you will enjoy conversations with me better than right
Well,
now. But right now,
I'm enjoying them now. So you're
thank you, sir.
underestimating
But
yourself.
will you tell me again that this American Institute of Homeopathy is the oldest medical association? Is that what you say?
In the United States, yes.
The oldest medical association in the U.S.
Okay, good. Well,
If
listen,
you-
I don't know if Barbara, do you have a question? I don't know if you're raising your hand, or you have to unmute yourself.
Several people had asked about biological dentistry. And
That seems to be a hot topic tonight.
it's so connected to the
Yeah, I agree.
And I do have a good biological dentist. But they have the whatever that special x-ray machine is that they go by. And but it doesn't take into consideration I mean, I would have thought they would have pulled the root canal teeth first. They look at other things in the x-ray. They don't pull the root canal teeth first. So I had a bunch of teeth removed by accident because I didn't realize that. I thought, and then now I've got 4 root canal teeth I've got to have done. So I'm going to lose more teeth. And so, and what it is they don't realize that lasers and probably the microcurrent machine can clear out a lot of the stuff, because I was using a laser I was using a laser to clear the pain out of my jaw.
And
And it
also
would get rid of
ozone,
the infection.
ozone can also clear.
Ozone could, maybe the microcurrent, I don't know.
Yeah, there's a lot of things, and homeopathy.
Because I've got terrific pain now in my mouth, and it's like I think eyes come before teeth, but I have like 4 root canals that I'm dealing with.
Yeah, I mean,
It's
if you're
very
having
painful.
pain, you got to take care of the pain.
Well, yes, but what they want to do is put the I won't have any teeth left. It's what it's going, it's what it's going to be. I don't know what it's going to be. I haven't decided. I guess it's up to me, but it's I know that they pulled teeth that were scheduled for it 6 months when they did the x-ray, and I got sick, and I thought, well, I better go ahead and have that work done. And so I had it done without questioning it, and I just assumed they would pull the root canal teeth, but they didn't. So anyway, my experience was not good. And I'm still
Well,
going to the dentist, and I trust her, but I know
well, there's
that she
good and
didn't know.
bad. There's good and bad biological dentists. Just because they're a biological dentist, though, doesn't mean they're infallible and they're not going to make mistakes or
Well, they don't
treat.
know. She didn't know. She
Yeah.
did not know. And so I'm saying she's following the advice of that x-ray machine.
Mhm.
And if I had just told her, please remove the root canal, I just thought that was the first thing they did, but they didn't. So
Well, there may have been a reason why she removed the other teeth. There may have been what they call cavitations
well, they
or
had
infections.
it showed bone loss and other things. But
Well, there's something called cavitations, which is a type of infection, and maybe that she felt that was a more serious issue than the root canals.
well, it might have been at that time because the root canals weren't hurting me so bad, but now they're hurting. But anyway,
Okay, anyway, we're coming to the end of our hour here, and I want to thank all of you. Hope I helped answer some of your questions. And, for more information, go to the website, the videos, get in touch with Chris. And I'll be having another one of these meetings. Again, we have them every month, second Saturday. But these meetings are primarily for people who are just beginning or have questions. So you folks that are doing the treatments have already had a consult with me. There's other meetings for you. All right. Well, listen, blessings to everybody. Take care.
Thank you.
Bye.
thank you.